Hi, my name is Betty. I'm so glad that you're here today. So, I'm Betty, and I am an operations strategist in healthcare field, and I work with home visiting entrepreneurs and practitioners. So, I help them with their administrative operations work, and I also help them to strategize simple ways of how they can, make their life easy. I'm also a home care provider. And so most of the things I will be talking about scheduling will be from the services that I've offered and also from the experiences with the practitioners that I have helped. So today we're going to talk about a topic that really eats the home visiting field. That is a topic that really troubles many entrepreneurs in healthcare. It doesn't matter where you are, if you're in home health, if you're in home care, if you're a visiting physician, it doesn't matter, but it's a situation that affects everybody. And so that's to do with scheduling. So scheduling sometimes can be very taxing, okay, especially when you're dealing with inconsistent employees in the field, or maybe if you just don't know what to do as an expert in the field. Sometimes you might come with expertise, maybe from the nursing field, but you do not know how to do the operations part of it. And so that's how I come in as an operations strategist and help you streamline these things. So if you need care, at the bottom of this video, you will find a way of connecting with me. And also just to highlight, I will be having a webinar coming soon, and the webinar is going to be on the 29th of March at 9 a.m. Central Time. So in this webinar, we're going to be talking about how to start a home care. So if you're interested, you will find the details right in this video. Don't forget to subscribe and just follow me as we go along with these bites for our sessions. So our Tuesday bite today is going to be about scheduling. So one of the things that we find is we waste so much time. Sometimes we waste so much time driving. I have experience from doing home care, like literally being in the field and having to drive from one home to another. So one of the difficulties I did experience was having to be all over the place, like we're not zoning properly. And when you schedule visits, you need to zone properly so that you don't overwhelm your caregiver, you don't overwhelm your doctor when the doctor is going for visits, you don't overwhelm even the nurses and the physical therapies, okay? Because sometimes drive time can be very, very taxing. Not even the visit, it's the drive time. I think for me, when I was doing the field work, the drive time was the biggest issue because sometimes you'd go and find traffic, or maybe if you have one person in the west and another one in the east, and you have like a 45 minutes drive, and the employer doesn't want to understand that this is not making sense. So even as an entrepreneur and also as a field person, you have to consider so many things. So my suggestions would be, having to map out the areas. Most of the times people will just say yes, like employees will just say yes to just random schedules, but that doesn't even make sense because sometimes it can be a Thursday where somebody is accepting 10 visits for Friday, and that doesn't even make sense, to do it, especially if you have to, if you're a CNA or if you're a nurse or if you're a therapist, you're given 10 clients and they're all over the place. It doesn't even make sense. So I just want to give you a small strategy of things that you can do. First of all, I think the basic thing you can do is having your team, whether it's the caregivers, whether it's the CNAs, the nurses, the therapists, whether it's the doctor, having the team tell you what, because you already know if you are in HR, or if you already have that information at hand, you're able to know where the client, the caregiver lives. For example, maybe somebody lives in Fort Worth, something like that. So you would naturally assume that this person that lives in Fort Worth is able, and that's Fort Worth, Texas, yeah? So they're able to see clients in Fort Worth. and then they're able to see clients maybe in the HEB area, or they're able to see clients maybe in the mid-cities area. Let's just give that a rough example, But you might find that same caregiver is flexible enough to go to Dallas, okay? So you have to have this, you have the basic, write down all your basics for your employees or your practitioners or the nurses, and then write the other option too that they have. So what I found easy was asking someone, okay, you live in Fort Worth. Okay, so which areas can you go? Your immediate areas, the areas we call you for scheduling, you will not say no. And pretty much people are very open. They will tell you every area they can go to. Then you tell them, okay, option B, if I have a client on this, which of these areas can I call you when I have a client? And trust me, people will write down. You can call me for Dallas. You can call me for Waxahachie. You can call me for Midlothian. Okay? So things like that. Excuse me. So you have to really make sure that you are very familiar with your region, so that you're not taking people all over the place and frustrating them, and then having a turnover that doesn't even make sense. And most of the time, the field people, they will complain about drive time. They will complain about the workload they're given and drive time. Drive time will always be there. So one of the things I can suggest for you to do is to do zoning. So you do a geographic zoning. So I just took a snapshot of the DFW area. I just took a snapshot of the Dallas area. So let me just give an example. I'm going to share my screen with you, and then I'm going to just share that example with you so that you can see what I mean by that. Now, for me, it's been easy to I'm in the Dallas-Fort Worth area, so I divide it by 4. So Irving being my very central place. Irving is very central. If you think about it, when you're in Irving, it's kind of easy to move everywhere. So Irving becomes my central point of my scheduling. But then I have 4 quadrants. So I have the Dallas, I have the North Dallas, I have the South Dallas, and then I have the North Fort Worth area, and then South Fort Worth area. And then I have to also consider, so what happens, let me share my screen and show you. I'm just going to try and play around with the mouse and just show you, what I mean, okay? So bear with me. So this is an example. So let's say this is Dallas, okay? So we are going to, I did mention a few minutes ago, you cut it into 4 quadrants, but you also have to note that even in Dallas is very big and Fort Worth is very big. So I would go ahead and even add another quadrant for Dallas. And know, you can say, for example, let's clear this out. So let's use 75. So when then we say that, 75 here, we cut through 75, and then we cut through here. So let's say you have a caregiver that lives here in Farmers Branch, right? So you'd make this their area. So you have clients in that area. And then let's say you have a caregiver that lives in Irving, so you can make this area their area. Then you have, and vice versa, you have someone in Mesquite covers here. So Highway 75 becomes the cut-off area. And then someone living in Garland, then you make this area their area. Okay, so now there's some things that you can do. So this, let's say you are, so I'm just going to remove the regions, okay? So these are 4 caregivers, for example. So you might find that maybe this caregiver in Garland wants to go on vacation, for example. So when this caregiver, so you have an understanding, like they back each other up, and they back each other up. These two back each other up. or vice versa. You can say Garland will back up Miss Kidd, and then Farmers Branch will back up Irving. So it's up to you. It's up to you as the business owner to communicate these backups. All right. So let's say, for example, Garland is not feeling well, and there are patients in this area that need to go. That is where you have to as a business owner, you have to decide, like with the caregiver too, not by yourself. You also have to involve the caregiver. So you can tell this caregiver, okay, they can talk to their clients, like if they have flexible clients. So you have some clients, they'll go maybe Monday, Wednesday, and Friday. And then maybe the clients on this side, they know that their caregiver is not available because they're not feeling well, but you tell them, we can try and cover at least 2 visits in the week so that you don't go unattended. So you can decide with them that, okay, Tuesday and Thursday, right? Okay, they'll be seen. Then remember, these two are the backups, right? These two are backing up each other. But remember, you have this caregiver here and you have this caregiver here. So you send, if there's more than visits to, like for this Tuesday and Thursday, if you have more visits, then you can send an email to Miss Kit and send an email to the one in Irving and be like, okay, guys, Farmers Branch is out and we need help. We already have help to cover 4 visits from the backup. The backup is covering 4 visits. We have 6 more visits remaining. How would you like to take the visits? Because maybe they might not be available, but would you like to take the visits? So this one says, okay, so yes, I can take the visit, but I can do it on Saturday. I cannot do it during my week. The other one says, okay, I can do it on Tuesday, but that's all I can give. So that helps you a lot, because you'll go back to these clients and say, okay, are you comfortable with having someone else come into your home, because we are able to cover more visits for you? So why don't we schedule this visit, and then we have someone coming up for you during the week, and you can cover more hours. Most of the time, these clients, they will say yes. Most of the time, they will say yes. They'll be like, yes, it's okay. Just do what you can until my caregiver comes back. Okay. Then the one from Miss Kate, you say, if this one maybe is not available completely, but this one is available, and they're like, okay, I can go on Saturdays. You have to come back to these clients. Okay. Remember, you've already sorted out with this one about Tuesday and Thursday. So you only have Saturday. So you can come back to the clients and say, we can still complete your visits for the week, but the person is available on Saturdays. Are you okay with someone coming to your house on Saturdays? And trust me, they'll not say no, unless they have family coming, or maybe they just don't like Saturday visits. Most of them will be like, yes, that's fine. Send someone on Saturday. So when you do that, you also have to let the client know that this is a different person. You might have to show them 1 or 2, 3 things of what they need to do, but this is a different person, but they are coming here. They're just coming to support while we wait for your regular caregiver to come. And you'll find that most of these people, they're very, very flexible. And sometimes they might even say, no, it's okay. I can wait until my caregiver comes. Okay. So you just consider those things. So those are tips I would like to give you for today. So the tip I gave was I gave a tip of dividing, like if you're in the DFW area, dividing the DFW area by 4, so that you don't overwhelm people with driving, because driving from Dallas to Fort Worth can be more than an hour depending on the traffic. And also driving within Dallas, depending on what's going on, can be chaotic. So my suggestion is using Highway 75 as a cutoff. And also, by the way, at the bottom here, you can also decide, to make maybe 635 too. You can always play around with this. You can play around with this and just make the drives as short as possible. You can use 635 or you can use 30, as the cutoff. It's up to you. You can do, however, if you want to do it in six areas, like 1, 2, 3, like this is 3, this is 1, like that, and this is Mesquite, and then this is Gallant. Remember, somebody in Mesquite can go to a place like, the eastern side, of Dallas area, the really outer side. But the thing is communicating with these caregivers or practitioners where they're going. So the other thing is to just, I don't advocate for it, but I experienced it where they just put the schedule on your tablet or wherever, depending on your scheduling system. They just put it there on your tablet. Then it's up to you to figure out. I don't feel that figuring out, some people may not be comfortable with figuring out, or some people may not literally know how to figure out scheduling, how to map out their schedules. So it's always nice if you help them out. And when you're scheduling, especially if it's a new person, you can always put like if it's a new person who you're scheduling, you can always put them in a situation where they are winning. Okay, put them in a winning situation. If you know a client is being seen twice a week, you can put that client on Monday and Thursday. Okay, you have another client being seen twice a week, Tuesday and Thursday. Okay, then you have a client that is being seen every day of the week. You can have them, like, you can have the zip codes close together so that when they finish their 4 hours here, they're able to go on this side and do their 3 hours, but they don't spend 1 hour in traffic. They can spend at least 20, 15 minutes drive. That's not so bad. And most caregivers will not, even nurses, most of them will not really complain about 15 minutes drive or 20 minutes drive. But the moment you start telling a nurse, oh, they live in Fort Worth and you're sending them to Anna, first of all, they will be like, no, I'm not going to Anna. That's too far. Find someone else, and then, even if you tell them that you're going to give them a bonus for that trip, they might go grudgingly, but you don't want that to be a situation where scheduling is an issue and then somebody leaves because you are really stretching them too far. Okay. So I hope today's tip has been good, and I hope today's tip is going to help someone with scheduling. If you need more help with scheduling, or if you need help with any operational issues that you may have, you are welcome to just schedule a call with me. And I'll be able to talk to you. And it's best if you schedule a call instead of direct messaging, because I might not see that. Okay. And then just a reminder that we do have a webinar. If you'd like to start your home care, specifically in Texas, you're welcome to join the webinar. Otherwise, the webinar has general information, but the licensing part of the information is just for Texas. Okay. Thank you so much for your time. All the information will be in the description. Please complete it. And if you need to get in touch with me. And also, I ask that you don't forget to subscribe and follow me. Hit the bell so that you can know every time that I come online. And also, this is a space for healthcare entrepreneurs. If you have anything that you'd like me to discuss concerning healthcare, concerning operations, let me know. I'll be dropping small nuggets on here for you to enjoy. Thank you so much. And until next time, I look forward to hearing and reading from you. Have a good day.